So right now we're going to click on the Clients button, or like I had stated before, you could go to the Client drop down and go to Client Management. But for right now, I'm just going to click on the Clients Quick Access button. So here is the Client Management section. So PIMSY is alerting me that Becky, the test user, is already open. Would you like to open a new one? And I'm just going to hit No. So when you come into this section, just make sure that you click on and highlight your client that you'd like to work on, and then it will populate the client chart on the right hand side. And so picture this as a virtual filing cabinet with different tabs that you can access anytime that you'd like. You don't have to go in order to be able to access this information. So today we're just going to go through the tabs that we utilize here at MAS. And so the first one is client details. This gives all of the basic demographic information, first name, last name, date of birth, address. There is quite a bit of referral information that you should be aware of. So this lists the date of referral. The default location is which office this client is based out of. The referral source will be the most recent referral, and the default division changes a lot based on referral status. And you're going to notice primary therapist, QP clinician 2, CM clinician 3, clinician 4. This is where we assign the different staff members for the different programs. These don't actually represent, yet anyway, any specific order or any specific title of a user. These are hardwired names that PIMSY uses. We can't update those to just say case manager or DLS coordinator, unfortunately. So it kind of throws some people off. I just always like to talk about that. Client social security number is kind of hidden right here. The active button will always show you if a client's active or not. And then date of admission. So the date of referral, the referral source is the program, and then date of admission. These three pieces will constantly change depending on how many programs the client accesses or discharges from or accesses again within MAS. The miscellaneous notes part is very, very important. This is for admin only. The referral coordinator documents all of the referrals that are received and assigned in this miscellaneous notes portion. So please don't write any type of note in there. That is, again, for admin purposes only. So there's a lot of information on this client details tab, just so that everyone is aware. And if you ever need to update an address or a phone number, please feel free to do that. The more accurate information that we have is the better to be able to service this client. So we're going to go to the next tab, which is the Demo Q&A tab. So here it has more demographic information, gender, the living arrangement. We use that as a different placeholder actually for the referral process. So this will indicate if they have any type of staff preference. So below you're going to see certain questions on the left hand side, and then you will see the answers to those questions on the right hand side. This is where a lot of questions are asked during the referral process. So it's important that you familiarize yourself with this section and be able to see what they're looking for. In the remarks section, you're going to see who gave the referral and their contact information. So that's really important. Next is the insurance tab. Excuse me. Next is the insurance tab. You won't have access to be able to change the main care number if the client has main care, but you'll also be able to see the main care number if you need to access it. This notes section is very important. This indicates what type of insurance the client has and whether it's active or not. So if it says full main care and Medicare or TRICARE or any other type of third-party insurance, currently at MAS, if someone needs a diagnostic assessment or if they're looking for outpatient therapy, it has to be main care only. And this greatly impacts a lot of clients, especially DLS clients looking to get a diagnostic assessment to get their eligibility letter. So just always be very familiar with this page and know what type of insurance that your client has. Next is the contacts tab. So if you wanted to add an emergency contact, or if the client had a legal guardian, it's very simple. You just click on it. It just takes a quick minute. And you'd be able to add that information here. And what's really great is that you can keep a history if people's contacts tend to change a lot or change their number. You can keep a history of that, which is really great. And so when you're done with that, you can just click exit. And it's crucial to understand that if an adult has a legal guardian, we must have that information within PIMSY, as well as any minor needs to have the legal guardian information listed in PIMSY as well. So there are a few tabs in PIMSY in the client chart that we just currently don't utilize. And a couple of those are the checklist and comments section, the medical tab. So we just don't utilize those because that information is kept in different areas. But we do use the diagnosis tab. So here is the diagnosis tab, and what you're going to see is, depending on how many programs this client is in, is how many diagnoses will be listed in here, because every program needs at least one diagnosis connected to that program. And DLS program, as well as Section 28, and HCT, they actually have 2 codes with them because they have a field staff as well. So you're going to see the F code diagnosis, the name of the diagnosis, the date that it was given. All of these should indicate primary if they're active, and you can see the status right here. In the description, we usually put, if it's an outside diagnosis, which agency we received that from, and then just scroll over. You will notice the inactive date is a year later. And this diagnosis was from Dr. Awesome. And then you'll see the division. So for DLS, there's a field staff division as well as a coordinator division. And then AOP, which is adult outpatient, just needs one because they don't have a field staff. What you will notice is that for programs that don't need their diagnosis up front, like DLS, they have a 30-day window at the start of services to be able to get that in. And you'll see that we create what's called Z codes to capture that 30 days until we receive the true diagnosis. And you'll see in the description, as an example, this is for an AOP open only. No other program can go off of their 30-day window. And so if you have any questions around the diagnosis, please reach out to your team leader or your program manager around that. We track these all the time in PIMSY to make sure that they're within compliance. It's really important that you don't allow your diagnoses to lapse so that we stay in that compliance. Oddly enough, we do not use the treatment plan tab in PIMSY. We have so many programs that it just does not support how many treatment plans there might be on a client. So we have different documentation that we track for that. Next is the renewals tab. Excuse me. The renewals tab is an auditing tool that is used by program coordinators and the referral desk. So it will indicate, especially when clients have a referral and when it's assigned. So that information is here, as well as any documentation that goes through an audit and that is represented in the Documents tab will be listed here if it's truly there or if it's missing. So this is a great snapshot to be able to go to if you're looking for the most recent audit. The next tab is one of the most important tabs in PIMSY. This is your Authorizations tab, and this is where you track all of your current authorizations for your client individually anyway. And we're going to go over a global view of how you can do a report to see all of your clients' authorizations and keep track of that. So you'll see the billing code. These are all non-billable service codes currently because this is a test client, but you would see what the billing code was if it was for Section 65 or if it was for case management, DLS, whatever it may be, will be listed right here. It'll show the authorization start date, the end date, how many units you were allotted, and the remaining units as you begin to use them. Now, pending units, it's a really important spot because pending units represent units and notes that you have created, that you have released to your supervisor for them to review and ultimately release to billing and payroll, but they're waiting on your supervisor to do that. So you could really blitz through a whole bunch of units and they could be in a pending status, and you wouldn't know that until you're looking at this pending units column. So it's really important to realize that your units will not decrement until they are released by your supervisor. And so people have gotten into some really sticky situations because they've blitzed through their units and they weren't paying attention to the pending units column. So there's a unit alert level as well as an expiration alert days. We don't usually utilize this. It usually just sends notifications through PIMSY, but we're using our notifications in PIMSY for requests. So just realize it's your responsibility to keep track of these authorizations and don't depend on PIMSY to do it for you because we're using our alert system for requests. Next, you're going to see the auth number. And so these aren't true auth numbers because they don't have the APS and the numbers after it. You might see some different wording here. If it says temp, that means that you have run out of units and someone had to put in a temp authorization to release some notes. That's a serious issue, and you'd want to reach out to your supervisor and program coordinator immediately. Or you might see the word unbillable, and again, that's a serious issue. That means that your temp authorization can not go through billing. We can't capture that, and that is tracked by program coordinators, the EMR coordinator, your supervisor, and they'll go over kind of the stipulations of that. So if you happen to see any of that there, that's just what that means. In PIMSY, you can always use your filter button. It's a wonderful tool to be able to look for a specific bill code because it can get kind of messy in here if you have 5 different programs and you just want to see your information. You can also look at active versus inactive authorizations to see something in the past. And you can search also by start and end date or any other field listed here. So next is the notes section. So any type of note created for a client is housed in the notes section. And that's for all programs. You'll be able to see the note number, the service date, who performed that, the billing code or program it's based off of, the note type, and then just, was it released on, and by whom. So that's really important information. And you can always double click on these and bring them up in case you'd like to review a past note. This is a really great place to do that. If you have a client transfer and you'd like to review what the client and their past provider were focusing on. Next is the Documents tab. So our Document tab has been recently revamped. It looks beautiful, by the way. And it's all done by program and year. So if you see these little plus signs, that means that you can open it up and at least one document is going to be there. So they're based on program and year. And you'll see, annual intake, assessments, diagnosis and eligibility. External documents are any document that originates outside of MAS. The only exception for this would be the diagnosis. We want this to be a quick access of that information, so any diagnosis is listed in this folder. Just be aware, if it's a third party, that you can't share it with anyone outside of the agency, unless it's the client themselves. Miscellaneous correspondence. This is kind of just where we put all the extra stuff, so to speak, such as discharges, KeyPro information, any type of fax forms, anything like that. Plans include treatment plans and crisis plans for all programs. Once they're in their different program and year set up, which is really nice. It's not all together in 16 different folders now, which is great. And then the working folder is where you put documents that need to be reviewed by your supervisor and need to be signed, such as a treatment plan, a comprehensive assessment, or a discharge, just to name a few. So you can just click on the button and it will button everything up. So if you're ever looking for something and you want to make sure that it's in the folder and that you've placed it there, it's really quick and easy to access. A little bit later, we're going to be going over how we file in PIMSY and how we use the working folder in a more in-depth manner. But this is just a quick look at the documents section. The next ones we actually don't utilize very much. It's the audits and surveys and status log. Those are for admin, and the admin just use them for one or two things behind the scenes. So, the ones that I showed you today are really the only ones that we utilize in PIMSY. We really track a lot of the other information just in the Documents tab section with our own forms and documentation. So anytime that you just want to go back to the Client Details tab, just takes you right there. So again, that was just a quick view of the client chart. Next, we're going to be going over the calendar. So if you go up to Windows, we can go down to the home screen and we can access our calendar from here. Or if you didn't want to go back to your home screen, you could have used the utilities, gone down to SAL and used the SAL calendar. So that's where we're going to go next. Hang tight.